Your lecturer is Dr. Muhammad Sumbul. I'm a lecturer of Human Anatomy and Embryology in Shams University. ILOs. During this lecture, we will describe the origin, insertion of the diaphragm, opening and the structures passing through it, action, blood and nerve supply. Also, we will describe the anatomy of breathing, muscles of the inspiration, and muscles of expiration. By definition, the word diaphragm means septum. So, it is a musculofibrous sheet that separates the abdominal cavity from the thoracic cavity. Description: it has two surfaces, upper convex surface towards the thoracic cavity and lower concave surface towards the abdominal cavity. It has two lateral elevated parts called copula. It has a depressed central part which is called the central tendon. It is attached to the whole bony circumference of the thoracic outlet. So the origin of the diaphragm will be from the sternal part, costal part, and vertebral part. The sternal part arises by two fleshy fibers or slabs from the back of the xiphoid process of the sternum. The costal part arises from the inner surface of the ribs, lower 6 ribs and their costal cartilages. The lumbar or vertebral origin. It arises by two parts, fleshy part and a ligamentous part. The fleshy part is through the right and left crus of the diaphragm, and the ligamentous part is through the arcuate ligaments. The fleshy part or the crura, it arises from, as we said before, by the right crus and the left crus. The right crus of the diaphragm arises from the upper 3 lumbar vertebrae, right anterolateral surface, and the intervertebral discs in between. The left crus arises from the left anterolateral surface of the upper 2 lumbar vertebrae and their intervertebral disc. The arcuate ligaments. We have 3 arcuate ligaments. First one is the median arcuate ligament. It is present in the midline at the level of T12L1 intervertebral disc. It is joining the two tendinous part of the two crura, right and left crus. The second one is the medial arcuate ligament. The medial arcuate ligament is attached to the side of the L1 vertebrae to the transverse one of L1 vertebrae. It is the second part of the psoas fascia. The third ligament is the lateral arcuate ligament. It is the second part of the quadratus lumborum fascia. It is attached from the transverse process of L1 to the mid part of the 12 rib. This is the median arcuate ligament, and as we can see, it arches just above the aorta. This is the medial arcuate ligament, and as we said before, it is the second part of the psoas major fascia. The third is the lateral arcuate ligament, and as we said before, it is the second part of the quadratus lumborum fascia. The insertion of the different origins, the sternal origin, the costal origin, and the vertebral origin will end, all these fibers will converge to end here at the central tendon of the diaphragm. As you can see, This is the right crus of the diaphragm. We can see its medial fibers converging and rotating around the esophageal opening. This is the esophageal opening of the diaphragm. So it will embarrass the esophagus when it is passing through the diaphragm at this area, making as a sphincter around the lower part of the esophagus at its gastroesophageal junction. Relations of the diaphragm. As you can see, the superior relation of the diaphragm regarding the right copula of the diaphragm here will be the base of the right lung, the right pleura, and for the central tendon here will be the pericardium and the heart. And for the left crus of the diaphragm will be the base of the left lung as well as the left pleura. Inferiorly, the right copula of the diaphragm will be related to the liver, right lobe of the liver, right kidney, and right suprarenal gland. The left copula will be related to the left lobe of the liver, left kidney, left suprarenal, spleen, fundus of the stomach. We have three major openings passing in the diaphragm. The first opening is the caval opening. It lies at T8 vertebrae. Second one is the esophageal opening at T10 vertebrae. The third one is at T12 vertebrae is the aortic opening. So we have caval, esophageal, aortic. 8, 10, 12 vertebrae levels. The first one is the aortic opening here. It lies at T12 as we said before. It lies just below the median arcuate ligament. Three structures are passing through this opening. The first one is the largest one is the aorta, descending aorta. We have the thoracic duct and we have the azygous vein. So through the aortic opening, three structures are passing: aorta, descending aorta, thoracic duct, and azygous vein. The esophageal opening, as we said before, it lies at opposite to T10 vertebrae. The structures passing through it is the esophagus, lower part of the esophagus, with the two vagi continuation, which will continue as the gastric veins, anterior and posterior gastric veins. The last structures passing through this is the vessels of the left gastric artery and vein, supplying the esophagus. Also, it is a site of a portosystemic anastomosis. The third opening is the caval opening, which lies at T8 vertebrae, 1 inch to the right side of the midline. The structures passing through it is the inferior vena cava, the branches of the right phrenic nerve passing through it, and some lymphatics coming from the liver to the lymph nodes in the thorax. These are the structures passing through the caval opening: inferior vena cava, branches of the right phrenic nerve, some lymphatic coming from the liver to the lymph nodes inside the thorax. The minor foramina of the diaphragm and the structures passing through it. Between slabs of origin at the sternal origin and at the costal origin, between the muscles slabs here, we can see the lower 5 intercostal nerves coming to supply the anterior abdominal wall. And at its sternal origin, we can notice the termination of the internal thoracic artery into superior epigastric artery and musculophrenic artery. So between the slabs of origin, we have the termination of the internal thoracic artery by the superior epigastric artery and musculophrenic artery, and the lower 5 intercostal nerves passing between the slips, muscle slips, to supply the anterior abdominal wall. Behind the lateral arcuate ligament, which is the second upper part of quadratus lumborum fascia, we will find the quadratus lumborum muscle and the subcostal nerve and vessels. Behind the medial arcuate ligament, here we can see the psoas major muscle and the sympathetic trunk. Through minute opening in each crura, we can see the greater and lesser splanchnic nerve coming from the thorax to the abdomen, and the hemiazygous vein, which pierces the left crus of the diaphragm to enter the thorax. The last one is the left phrenic nerve, which pierces the muscular part of the diaphragm and to the left side of the central tendon to reach the inferior surface of the diaphragm. These are the minor opening inside the diaphragm and the structures passing through it. Again, at the sternal origin is the terminal part of the internal thoracic artery. At the costal origin is the lower 5 intercostal nerves. At the medial arcuate ligament is the psoas major muscle and the sympathetic trunk. At the lateral arcuate ligament is the quadratus lumborum muscle and the subcostal nerve and vessel. Through the minute opening in each crus, we will find the greater, lesser splanchnic nerves and the hemiazygous vein in the left crus. The left phrenic nerve reaches the inferior surface of the diaphragm through a small opening here to the left side of the central tendon, anterior to the central tendon. Nerve supply of the diaphragm. The motor and sensory nerve supply of the diaphragm is the phrenic nerve. Its root value is C3, 4, 5, mainly C4 nerve fibers. The left pierces the muscular part of the diaphragm to the anterolateral to the central tendon, to the left side of the central tendon. The right phrenic nerve passes through the caval opening to reach the inferior surface of the diaphragm. Both the left and right phrenic nerve supplies the diaphragm from its inferior surface. Blood supply of the diaphragm. Arterial supply is through the inferior phrenic artery, musculophrenic artery, precardiophrenic artery, twigs from the lower 3 posterior intercostal arteries, and twigs from the thoracic aorta. Action of the diaphragm. It is the chief muscle of respiration. It is active during forced expulsive acts as coughing, vomiting, defecation, urination. Anatomy of respiration. The respiration consists of 2 phases. We have inspiratory phase and expiratory phase. The inspiration itself, we have 2 types of inspiration. We have quiet inspiration and we have forced inspiration. The quiet inspiration as we setting like now. The forced inspiration when we doing exercise and something like that. During quiet inspiration, all diameters of the thoracic cavity will increase. We have 3 diameters of the thoracic cavity. We have a vertical diameter, we have an anteroposterior diameter, and we have a transverse diameter. The vertical diameter extends from the thoracic inlet to the thoracic outlet. This is the vertical diameter, and this diameter will increase by the descent of the diaphragm downward towards the abdominal cavity. This will increase the vertical diameter of the diaphragm. the anteroposterior diameter of the diaphragm, which extends from the vertebrae backwards to the sternum anteriorly and the costal cartilages. When the intercostal muscles contracts during quiet inspiration, it will elevate the costal cartilages and the sternum anterior and forward, increasing the anteroposterior diameter. This movement is called a pump handle movement. The transverse diameter, which extends between the ribs, will also increase, and this occurs by contraction of the intercostal muscles, will elevate the shaft of the seventh rib and the lower floating ribs to the outer side, to the laterally. It will displacing them laterally or move them laterally, increasing the transverse diameter of the thorax. So during quiet inspiration, the contraction of the diaphragm and the intercostal muscles will increase the three diameters of the thorax. And also the contraction of the scalene muscle will fix the first rib. Okay, so this is the movements which occur during the inspiratory phase of the respiration. During forced inspiration, to increase the vertical diameter, the quadratus lumborum muscle will fix the 12 rib. So the diaphragm will take an extra power to descend downwards to increase the vertical diameter of the thorax. The anteroposterior diameter of the thorax will also be more increased by the contraction of the scalene muscle, which will not fix the first rib. Also, it will move the first rib, elevating the first rib. And by the contraction of the sternocleidomastoid, which will elevate the sternum and the clavicle. The transverse diameter of the thorax will also be increased by fixation of the scapula, by the trapezius muscle and the rhomboides muscle, and by the contraction of the serratus anterior muscle on the ribs will increase or extra increase the transverse diameter of the thorax. This is the accessory muscles which will contract during inspiration. These muscles again, to increase the vertical diameter, we will fix the 12 rib by the quadratus lumborum muscle. To increase the anteroposterior diameter, we will use the scalene muscle and the sternomastoid muscle to elevate the first rib and the sternum. And to increase the transverse diameter, the scapula will be fixed by the trapezius muscles and the levator scapulae and the rhomboides muscle to allow the serratus anterior to work more efficiently on the ribs, elevating the ribs laterally, so it will increase the transverse diameter of the thorax. Expiration. During quiet expiration, there will be elastic recoil of the lung and relaxation of the intercostal muscles and the diaphragm, and this will make the expiratory phase during quiet expiration. In forced expiration, there will be use of the anterior abdominal muscles, and the latissimus dorsi muscles will contract to push strongly on the diaphragm, drawing the lower ribs downwards and inwards. Thank you.